Hi, I'm Dr. Tessa Commers. I'm a pediatrician and have a special interest in reproductive health. Today I'm answering the question, what is the morning after pill? The morning after pill, like Julie, is a form of emergency contraception. Emergency contraception is something that's used by someone with female reproductive organs to prevent pregnancy after unprotected penis to vagina sex. Now there are a couple of things that I want to talk about there. The first is unprotected sex, and the second is female reproductive organs. So what is unprotected sex? Unprotected sex is defined as any type of penetrative penis to vagina sex that does not involve birth control, or if the birth control method failed. In these cases, if the individual with female reproductive organs wanted to avoid pregnancy, it would be recommended to take the morning after pill, or another form of emergency contraception. The morning after pill is most effective when taken up to 72 hours after unprotected sex. It's not as effective as regular birth control, but it's up to 87% effective when taken during the time period recommended. So why is it only 87% effective? Well, it all has to do with the female reproductive system and how pregnancy occurs. The first step in pregnancy is the fusion of sperm and an egg. Sperm is introduced into the female reproductive system through penetrative sex via the penis. Sperm can actually hang out in a uterus for 5 days. And the egg gets into the uterus through a process called ovulation. And when does ovulation occur? So this is all a part of the menstrual cycle. Sometime between 2 periods is ovulation, or when an ovary releases an egg. The egg can only survive for up to 24 hours. So during that time, that's when fertilization, or the fusion of a sperm and an egg, must occur in order for pregnancy to happen. However, if there's no egg, then no pregnancy can occur. And that's where the morning after pill comes in. How does it work? The morning after pill works by preventing ovulation. So if the sperm is hanging around and there's no egg, then no pregnancy can occur. It's important to know that the morning after pill is only effective before ovulation has occurred. So if ovulation has already happened and the egg has already been released, then the morning after pill will not be effective and there is a risk of pregnancy. What happens after I take the morning after pill? The morning after pill is essentially a surge of hormones that's delivered to your system. And so the side effects and things that happen after taking the morning after pill are a consequence of that big hormone surge. The main symptoms that happen up to 72 hours after taking the morning after pill include things like nausea, breast tenderness, abdominal pain, headaches, and fatigue. Those should resolve after a few days, but if any of them are longer lasting, it's worth talking to a doctor. Now, the biggest side effect of taking the morning after pill is going to be menstrual changes and spotting. Spotting is abnormal bleeding that occurs between periods and is a very common side effect of the morning after pill. Many people also experience a delay in their period or very heavy periods. Now, a delay in a period can be a little bit confusing, and someone might wonder, is my period late? Did the morning after pill actually work? Or is this a side effect of the morning after pill? The only way that you can know for sure is by taking a pregnancy test. So if your period has not come 3 weeks after taking the morning after pill, it's recommended to take a pregnancy test just to make sure. That being said, remember, a delayed period is one of the most common side effects of the morning after pill. So don't panic. I hope you enjoyed this video. If you're interested in learning more, we'll be uploading videos like this every week, and you can follow along. If you have any questions for us, you can leave them in the comments section. Thanks for watching.